Let's take a moment to talk about administrative workgroup alerts and the appropriate action needed for each. Anytime the status of a patient changes, the administrative group will receive an alert. Action. This alert is simply informative, and the user may delete the message. Anytime a patient's funding source is changed, an alert is sent to the administrative group indicating what the funding source was changed to and what user changed the funding source. Action. This alert is simply informative and may be deleted. Anytime an initial authorization questionnaire or reauthorization questionnaire have been completed for a patient and signed, the administrative group will receive an alert. Action. The administrative group user will then click on the patient attachment, which will navigate the user to the Authorization tab of the patient record. The user will then click the button for the authorization request form and follow the standard process for inputting the authorization information into the Choice PA website. Anytime a place of service address is added or changed, the administrative group will receive an alert. Action. When a user enters a new place of service address, an administrative user will click on the attachment to open the patient record. The administrative user is then responsible for ensuring that all fields are completed appropriately. This includes the type of service location, first and last name, not simply grandma's house, adding a ZIP+4, indicating the county and the phone number. If the service location is already set up as a facility or should be set up as a facility, the administrative user should delete the newly added service location and add the facility service location by means of the Add Service Location button. In this way, the service location will be linked to the facility in the database versus a standalone service location. Anytime an addendum is signed for a patient, the administrative group will receive an alert. Action. The administrative user is responsible for reading the EMR addendum to determine why it was written. Depending upon the reason for the addendum, the alert may be informative or it may be actionable. To view the EMR document with an addendum, click the EMR attachment button on the alert message. The user will then be navigated to the EMR document. The user should scroll to the final page of the document to view the addendum. If the addendum impacts the manner in which the service should be billed, the addendum alert should be forwarded to the billing group. If not, the message may be deleted. Examples of items that impact billing of a service include place of service addresses, incorrect dates of service, incorrect type of service. Anytime a patient with the status of active patient-new has a plan of care assigned, the administrative group receives an alert. Action. If the patient has a funding source that includes Medicaid, there should be a message for an initial authorization questionnaire that is actionable. If the administrative user group does not see an initial authorization questionnaire message, the user should reach out to the clinician and ask them to complete the initial authorization questionnaire immediately. In the case of a Medicaid funding source, the alert message is informative and can be deleted. If the patient has a funding source that is not Medicaid, the administrative user should click on the patient attachment, which will navigate the user to the General tab of the patient record. The user will then change the patient status to Active Patient. Next, the user will click the Patient Message to SLP button. The user will type a message informing the therapist that the patient has an active status and is ready to begin services. If a patient has been assigned to a user and the patient does not have an evaluation or therapy appointment scheduled within 14 days, a notification is sent to the administrative group to follow up regarding why. Action. The administrative user should follow up with the treating clinician to determine why an evaluation or treatment has not been scheduled. Anytime a discharge summary is signed for a patient, the administrative group receives an alert. Action. The administrative user will need to view the patient's EMR discharge summary. Begin by clicking on the patient attachment to navigate to the patient record. Click on the EMR tab of the patient record, select the document type of discharge summary, and click Search. The discharge summary will appear in the EMR. Double-click on the document to view it. Read the reason for discharge indicated by the treating clinician on the documentation. Navigate back to the General tab of the patient record. The user will need to indicate the date that the discharge summary was received in the Discharge Instructions Received field. Finally, the administrative user will need to select a reason for discharge from the drop-down selection. These selections will appear on reports related to discharge patients. This concludes the instructions related to administrative group alerts in the administrative portal of ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written Administrative ACE Manual for detailed instructions and screenshots related to specific features and tasks.